Charles Raison. I'm on the steering committee for the U.S. Psych Congress. I'm here with Dr. Tim Wilens from Harvard. Thank you for joining me. You, of course, are a great expert in ADHD, and one of, I think, the challenges many people face in these, especially in young people, is differentiating between ADHD and bipolar disorder, because phenomenologically they can look very similar, especially early in life. Talk to me some about how one can begin to better differentiate these conditions, because clearly the treatments are different, the outcomes are different. So it's really an important question, I think.
It's a huge clinical issue that arises, and in some ways it's one that can sometimes scare clinicians away from wanting to step in to take care of these cases. So just to get the sense of the overlap, if you start with a kid with ADHD who's growing up, depends on the samples, but 5 to 15% are going to develop bipolar disorder over their lifespan if you start with ADHD. On the other hand, if you start with a kid who has bipolar disorder at a young age, 70–80% of them have ADHD, so they're most likely to have it. What I think is important in recognizing the difference is, while there is some mood symptoms in ADHD, it's really more frustration intolerance, irritability, emotionality. We call it emotional dysregulation. Bipolar disorder brings with it mania. And that's the definition of bipolar disorder, mania. So these kids are agitated, severely rageful, not just irritable, rageful. They stay up at night, they're not tired the next day, super hyperactive, and you can't settle them down with structure. ADHD, you can settle them down with structure. They're causing dangerousness. They're really active, beyond normal activity, etc. And for those individuals, you might suspect that there's a mood disorder of a bipolar type. What's important is to identify that, because what you can do is, if you treat the bipolar disorder with what we use for the bipolar symptoms, which we typically use second-generation antipsychotics now, you can stabilize the bipolar disorder, go back and see what type of ADHD symptoms they have, and there have been a few studies that have been controlled and well done that would indicate that in a stabilized bipolar patient, you can then use stimulants, and you'll find that not only do they treat the ADHD, but you'll have reduction in the bipolar, further reduction in the bipolar symptoms. So it's a good outcome.
That's fantastic clinical advice. Thank you so much.
Thank you.